Osteoarthritis is often referred as wear and tear issue, and it's very common joint disorder in the US, affecting more than 27 million Americans. Osteoarthritis symptoms involve a progressive loss of articular cartilage, subchondral cyst, osteophyte formation, periarticular ligamentous laxity, muscle weakness, and possible synovial inflammation. Typical symptoms are felt in the groin area and it might go down to your thigh. Sometimes you might feel issue also in the gluteal area. Symptoms typically provocate from everyday activities and they calm down during the rest. When the issue is getting worse, then you might experience locking of the joint and you might hear clear acoustic response from the joint when you are moving the hip. When we reach up to our 50s, then the prevalence of hip osteoarthritis is at its peak. When you reach the point when there is no cartilage present in your hip, and the resting pain is so bad that it sometimes keeps you through the night, then you might need to do something to improve your hip health. Typical indicators that could lead you to ending up into the surgery table is joint pain with no easing factors, resting pain during the night and day, clear limitation in everyday activities, walking is limited due to pain, difficulties climbing the stairs, if washing or putting the shoes on are difficult, then you are going to end up in the surgery. Bone necrosis in the hip. If you are a heavy smoker or overweight, positive results from the surgery might be limited. If you are having the pain and would like to compare your normal range of motions to the other hip, here is an example for the normal hip range of motion. Abduction should have 50 degrees range of motion, adduction with 30 degrees. Internal rotation should be around 30 degrees and external rotation should be roughly 40 degrees. Hip flexion should be around 120 to 140 degrees and hip extension is closer to 20 degrees. To know your hip osteoarthritis is progressive negatively, your range of motion should be significantly less than this average, and also compared to non-painful side. If you are not ending to the surgery table soon, I have a good movement, mobility and muscle exercises for you at the end of the video. But let's check some literature to understand the exercises we will do at the end. Persson et al. 2019 conducted a systemic review of the recent studies to explore the most effective exercise program to improve pain, function and performance, and also quality of life those struggling with hip osteoarthritis. In 8 weeks, the best way to ease the pain and improve the performance was aerobic endurance training. For function and improvement in quality of life, the best exercises included chai, mindfulness and relaxation exercises integrated into physical movements. The best performance was gained from some sort of muscle contraction training. How about exercises in water? Bartels et al. 2016 had systematic review of aquatic exercises. From the review, the takeaway message was that there is a clinically relevant effect on the level of the pain, quality life and degree of the disability when exercises is done frequently. If the pain is the biggest factor in your case, I hope you have some tool somewhere close that you are able to use in your regular exercises. If you are waiting for a surgery in the coming future, then Sakkinen et al. Have you covered. He had studied in 2013 and the plan was that if group does regular exercises, how many still want and end up in surgery compared to education group only. In 6 years of monitoring the group what has exercised regularly, the percent of the participant what ended up having the surgery was lower when compared to education group only. And if the surgery is close future for you and you need clear instructions for the training in water and on the ground, Rooks from 2006 has what you are after. In the study, they had 6-week exercise programs what participants completed. Clients who did the training got better rankings in overall health, and post-surgery rehabilitation in the participants was better in multiple variables. How operated hips will last in use? In Kiran's article, 97% of the cases had 22 years with one surgery. Heart article got info that 75 to 100% the cases will last 15 years. Gill's article told that 75 of the cases lasted 22 years, and Evans had paper where the info was that 58% of the cases lasted 25 years. If you are wondering what kind of exercises should be done, then the America's big guidelines for the adults for the physical activity is a good starting point. For aerobic endurance, it is suggested to have 2 hours and 30 minutes of moderate exercising or 1 hour 15 minutes of vigorous exercise per week. If you are wondering what kind of exercises should be good for the muscle, then using large muscle groups 2 times a week is enough to maintain good balance on that side too. If you do 45 minutes of the muscular training per week, add hip exercises top of it, and you are good to go. Check exercises at the end of the video and attempt each exercise unless it promotes resting pain. I've got really easy version and a harder version for each exercise. For the repetitions, start from the 6, do repetitions 6 in a row, then do all movements and have a rest. Then do 5 repetitions in a row. Change the starting number so that you feel fatigued after the training. If you have really bad resting pain, the big picture is this. When the movement is present in everyday activities, you don't need to worry about joint cartilage health. When you maintain good level of activity and the health in your life, you will get better quality of life in the long run. Also, with physical exercises, you can prevent all sorts of lifestyle diseases. If you have questions, put them down below in the comments and I will respond. Give this video a thumbs up and let's go through the simple exercises.